we're gonna go ahead and get started because we have a lot of good information we're gonna share, and want as many questions to come out as possible. I know we have a hard stop because we have another 5 o'clock meeting as well, and this is very, very important to not just me and my commissioners, but also very important to this entire community. We set the tone so many ways for the region in terms of all the great things that we've been able to do in the last several years in terms of job growth and investments and all those things to continue to move in the same positive, strong direction. So this will help accelerate that speed, and we're certainly looking forward to it. So I'm going to stop right now and introduce, of course, my listening aide, the chief of staff, and the person who functions in all kinds of spaces, Darius Beckham, in terms of policy aide. Sort of kick this off because he's sort of running with his baby as well. Darius.
Thank you, Mayor. Appreciate that. So welcome to the public. Thank you, Mayor, Commissioner, City Manager's Office, everyone else that's here. So today's work session is going to cover the City of Dayton's peace campaign as well as our ongoing and kickoff of the Cure Violence effort. And we're thankful to have Q here from Cure Violence Global, who's going to speak to all of the work that's going into this partnership.
We made a distinction. I just want to make sure, so this is not Q from 007 James Bond, but his name is Q, and I find it very interesting. So I'll let you continue.
We also are joined by the Owen Group, so I'll just let both Quinones and Jenny introduce themselves, and then we'll get moving.
Thank you, Mayor. Thank you, Commission, and to the citizens of Dayton, and thank you, Darius, for the introduction. My name is Quinones Corneal. Most of my colleagues call me Q. Either is fine with me. I am a regional associate director for national programs at Cure Violence Global. A little bit about my background: I have more than 15 years in community mobilization. I have seven years in law enforcement and violent crime and community engagement practices in Louisville, Kentucky, where I'm based out of. So I'm excited to be speaking with you all about the model and what we're going to be doing with the City of Dayton and our partnership. Thank you.
Yeah, it's good to be here partnering with Q. I'm Jenny Michael. I'm the co-CEO of the Ullman Group. We've been brought in to help the city around the peace campaign, and really predominantly our work has been around facilitating community conversations and generating ideas. And I'm going to take you through some of that along with Darius this afternoon.
Thank you, Q and Jenny. So as they both said, we kind of think of these efforts as an entire collective impact approach. So the peace campaign will really act as an umbrella, and as we move forward, you'll better understand how the Cure Violence effort will fit under that. So specifically in regards to the peace campaign, this will be led obviously by the Mayor's office, the City Commission office, and this is in an effort to create intervention, community prevention, and engagement. And you'll see later on how each of those are going to be subcategories for the peace campaign. As Jenny said, we brought in the Ullman Group, who have been facilitating our community listening sessions and work sessions. They've also supported us on design and media as we get the peace campaign introduced to the public in the greater Dayton community. These work sessions have consisted of about 20 community partners, or more actually, everyone from Omega CDC, Victory Project, Boys and Girls Club, Dayton Public Schools, of course, and we have several more organizations that are also represented, and some of them are here today. So Jenny's going to speak specifically to what has happened in these work sessions thus far. We're only going to take about 10 minutes of your time today, and then we're going to kick it over to Q to really go in depth and use most of the time to talk about Cure Violence.
Thank you for that, Darius. As we go to this first slide, we'll talk about our first session, which was November the 12th. It was about an hour and a half. We'll go ahead and go to the next slide if you would. Just jump right in. And just some visualization for what we did. Again, a shout out to NCCJ. Adrian's joined us in here today. Other leaders from nonprofits, community organizations. You can see our 3 pillars up there: violence reduction, youth development, community engagement. And if you look at all those sticky notes up there, those were all ideas generated from the team that we then use sticky dots to multi-vote, say where are the highest priorities for our community. And the whole purpose of this was really to engage community organizations who are on the ground in the communities doing the work and say, what does really peace in Dayton look like for you? This isn't a 1-year plan. This isn't a 5-year plan. This is a multi-generational kind of kickoff for what if we made Dayton the most peaceful city in the world? What would that look like? So we led that hour-and-a-half session to really facilitate a conversation around that and get people thinking bigger. So what came out of that? And if we go to the next slide, we'll talk about that. There were more than 111 ideas generated across and 45 different things that needed to be eliminated or reduced. We used placemats where people told the story of what peace would look like in Dayton. We generated ideas around the pillars, again, community engagement, youth development, violence reduction. And again, there was voting to say, if we were going to do something tomorrow, what is the highest impact with perhaps the lowest effort, right? That we could just do now versus what would be high impact, but perhaps more effort that we maybe need to plan for it and do on down the line. Ideas were around art murals and violence reduction in terms of trauma-informed care and mental health counselors, how to get youth in jobs and ready for the workforce. So all sorts of ideas. But let me tell you a little bit about session 1 and one of the misses, right? Because we always like to say, what do we learn from that? It was really obvious that having youth at the table was a critical part of this peace movement. We had to make sure that we had youth represented. And so that was really heard loud and clear, and proud to say we had some great youth representatives at the second session. And we also said, well, we're pretty vague and broad, right? It was meant to get the juices flowing, but really, how do we put those into action and make them really actionable? And that takes us to our second session. So in our second session, you can see another great crowd with the West branch of the library. It was just a beautiful place to host this. We were on December 10th, and we spent 2 hours there. And you will see we had youth at the table. In fact, in each of the subgroups, we broke out by those pillars. Again, I'll keep reinforcing those. Violence reduction, youth development, community engagement. We took all those 111 items, we divided them up amongst the tables and said, okay, now plot these. What could we go do tomorrow? How would you plot those in terms of effort and impact? So we went down and we ended up assessing 56 ideas. You can see there kind of high impact, high importance, low impact, and really what would be logical next steps. And what the idea behind this was is to take those that were in the high impact category and have those, because the next step on this is to break out in subcommittees and do the work that is associated with this. So that'll take us to kind of our next steps here. And I wanted to end on this logo, this icon. We developed this as a sort of a central kind of calling card for peace in Dayton. And so when you see this, whether it's on a pen, we already had some of the youth in the room saying, can I get that on a t-shirt? When you see this, this is kind of a rallying cry for us, a mark that says, we are a peaceful city. This is a place of peace, and we aspire to be peaceful. So now the next steps for this is we took all those 56 ideas that were categorized, and we turned over to the city the different people who participated, how we would break those out into sub-teams. Darius has already sent an email out to them, and those ideas are handed over to those subcommittees for actual implementation. And I think it's important to note, one of the things we really emphasized in that second session is assume it's budget neutral. If you had to work with the resources that existed today, how do we bring some of those organizations and dollars that already exist together to make the most impact in terms of these ideas?
So as we think about next steps, it's going to be key, obviously, as you look at this org chart, for these subcommittees to take those 56 ideas and start to identify, as Jenny described, what we can do now and what we can do later, and what's high impact and what's low impact. So we have a great place to start. We're looking to get these subcommittees moving here in the next couple of weeks. So some of you in this room who have been in these meetings have probably got some emails from me, and you'll continue to get those because we obviously want to keep the ball rolling on this. And as you also look at this, you'll see specific to the violence reduction subcommittee, that is where the work with Cure Violence will fall right into, which is a great segue for me to turn this over to Q, who's going to go into depth on our partnership with Cure Violence Global.
Thank you, Darius. A second to get the presentation pulled up. All right. Again, thank you for your hospitality to everybody in attendance, and to those who have my back turned to. I apologize, but I appreciate your support and your interest in helping Cure Violence Global and helping your city become safer. All right. So this is not our 80-slide CVG one-on-one presentation. This is a condensed 10 to 12 slide presentation, but I want to cover kind of the history of Cure Violence Global and how we've kind of grown to where we are today. So we'll focus on the creation of the model. We were established in the late 1990s by our founder. His name is Dr. Gary Sluckin, who still serves on our board to this day. But he was a professional working with infectious diseases overseas, kind of tracking diseases such as tuberculosis and so forth. But when he returned back to the States, he realized that we were dealing with our own epidemic, and that was gun violence. And at that time, he was focused on where that was happening most in our country, and unfortunately, that was in Chicago, Illinois. So he took a innovative approach and took what he knew from his background working with the World Health Organization and said, "Wait a minute, gun violence is similar to any other disease that we've attempted to or treated here in the past, or that we are treating in the future." So we launched our first program in West Garfield Park. It was heavily known for its frequent of gun violence instances in that community. And in the first year that we piloted the program, we saw a 67% reduction in shootings in the first year, okay? So we gained some popularity, of course. People started finding out. We started getting calls from other cities around the country, such as Baltimore, New York, Philadelphia. And we started to also see really impressive reductions in the communities that implemented our model. So you go on, later on, we began to establish an international presence. So that's why now we are called Cure Violence Global. If you are familiar or heard about our model, back in the day, it was called Ceasefire. So if you're familiar, so the Ceasefire model is very similar to the Cure Violence Global model. It's just that now that we've established partnerships all over the world, we'll talk more about those partnerships and how they're similar and different from our national programs. All right, so what makes the Cure Violence Global model unique, right? It's our approach. It's taking what we've learned in terms of epidemic control and utilizing a public health approach, combining the two, but also the missing ingredient or the key ingredient is the community engagement and involvement of that, right? It's taking people with similar lived experience and utilizing them, empowering them to make a difference in their community. So you talk about the term credible messengers. It's a very prominent term now. There's a whole film called, I think it's maybe at the end of the slide, called The Interrupters, that featured some of our team members back in the day when we were Ceasefire. But that credible messenger term is very key, right? And here's the thing to remember: what may be credible in Dayton may not be credible in another city or another part of the world where we implement our model. So what determines the credibility is the target area that you're looking to implement our model in. Thank you. So we talk about looking at gun violence and the implication that it has on public health, right? The first thing we're going to talk about is the risk, right? There are preventable risk factors, right, that causes one to either be more prone to gun violence as a victim or perpetrator, or less prone, right? And then you talk about the effects on your physical and mental health, right? If you've ever been involved in a situation pertaining to gun violence, whether on the job or as a victim or even as a former perpetrator, then you personally know the effects of gun violence on your psychological and your physical well-being. You're talking to somebody who on the job, I've been attempted carjacked by an individual before, right? And that was probably 5 to 6 years ago, right? I still deal with those effects today, right? Because of the longstanding effects of gun violence, right? I have to educate my family and friends on those effects, right? They know, don't walk up on my car if I can't see, because of some of the things that I've dealt with from that in the moment. So you talk about the longstanding effects of gun violence. Then we look at the effects on the social determinants of health, right? And how when you look at communities that see gun violence at a much higher frequency than some others, you start to look at what is the access to health care in those communities? What is the quality of education to those communities? What does the food equity look? What does that look like, right? A lot of times you see food debtors in communities heavily affected by gun violence. And so it's all these other barriers that are intertwined to the negative results that we're seeing. Hey, again, I just covered it, but we talked about disparity in health outcomes. We talk about the healthcare costs, right? Gosh, man, I've seen several reports of what gun violence is doing to our healthcare costs, and a lot of individuals who are caught up in this ongoing battle with gun violence, whether it's being a persistent victim or a perpetrator, and a lot of times it's both, to be transparent with you all, is that a lot of them don't have healthcare coverage, right? So who's taking that on? It's taxpayers taking that on, right? And so when you talk about identifying solutions, it doesn't just affect the numbers of violence that's taking place on an annual basis, but it's affecting other things, including how much money that we spend to take care of this, right? And the last one is violence acts as a contagion, which we're going to dive into on the next slide, I believe. All right, so again, violence has 3 characteristics of epidemic disease, okay? At Cure Violence Global, it's not a metaphor, right? It is fact that violence acts as a disease. If you look at the first demonstration there, you see a map of cholera, and then you see a map of gun violence, right? It clusters, right? There's a lot of similarities between the two. Can we go back one slide? Sorry about that. No problem at all. All right. The second is it spreads like a disease. So you see the graph there of the flu, and then you see the gun violence, right? This up and down nature. And that's dependent on what things are going on in the community, all kind of things that go into that. And then lastly, one of the most important is that it transmits through exposure, modeling, social learning, and norms, right? The biggest part of that, it is what is perceived as normal in communities that see a high rate of gun violence. All right, so Cure Violence Global, one of the things that I like to brag about is that we've been very successful utilizing our model in various contexts, okay? Our model is just about proving universal. We've had pilot programs or solidified programs in terms of domestic violence. Gender-based violence is where you see a lot of our Latin American partner countries. There's a lot of gender-based violence. It's not better or worse in terms of violence, it's just much different. All right, you have belief-inspired violence, prison violence, and all these other type of, different type of violences. And even now, we're piloting with groups in political violence. So there's a lot of well-known political groups that have been violent in recent years that we're actually working with to decrease those numbers as well. The beauty about it is that we know how to stop health epidemics, right? There's 3 main approaches to that. All right, first thing we have to do is interrupt the transmission. We're going to prevent future spread. And the last one is changing group norms. Again, we're going back to what is perceived as normal. The rates that we're seeing gun violence in our country, I know in my city where I'm based out of in Louisville, Kentucky, it's not normal. It's not normal, but if you spend long enough in it, it becomes your normal. You start to believe that it is normal. So you stop having hope. You stop doing things and trying different things. You stop, worrying about making it past 25, right? So you look at these 3 things, and if you look at them, we did this same thing just a few years ago with our COVID-19 pandemic, right? When we wanted to slow that down, we did these 3 things. We interrupted transmission. How did we do that? We kept everybody at home, right? You didn't come to work if you weren't classified as essential, right? There was times that you had to shop at the grocery store. That was for you, right? I remember, we had a schedule. We could go on Tuesdays and Thursdays between 8 and 10. That was the time for our community, right? And so then you prevent future spread. How do you do that? All right, again, you're limiting interaction, you're educating people, and then you talk about changing the group norms. And what's the perfect example of that? We wore masks. All right, that became normal. For some people, it's still normal. All right. And so a lot of us are better about washing our hands and taking care of our personal hygiene. So that wasn't a thing 5 years ago. But because of what we experienced, it is now the thing. And we're now proactive about those things. So the same methodology is now being used or has been used at Cure Balance Global to produce favorable results for communities like Dayton. All right. So if you're asking, what does this mean to me? Why is this relevant? It's because obviously we're here because we're now in partnership with you all. We're here to service you and provide our services and expertise so that we can provide, conduct the Cure Balance Global Assessment. So and we're going to talk a little bit more about that. But essentially, we were contacted by representation from you all city. And the way implementation works is, if you see in the first block there, there's typically an implementation agency, right? Could be the health department, whether they're state or city level, could be the mayor's office. A lot of cities now have an office for violence prevention if they're still standing. But there's usually some type of state or government agency that is bringing in the partnership, right? That doesn't mean that particular agency is going to be the ones implementing the model. It just means that they had the resources to bring the model to the community. Okay. Another key piece in the implementation is utilizing community-based organizations or grassroots organizations to actually implement. Why do we use those? Because they're the organizations that know the community, that can recruit the staff necessary to affect change, right? They have the connections to credible messengers, okay? But they're not doing it alone, right? It's not, here's the funding and we're just going to let you all do your thing. No, this is an all hands on deck solution, okay? What Cure Balance Global is not, it is not a replacement for other strategies, right? It is not a replacement for law enforcement. It is not a replacement for prevention services. We stay in our lane, right? And it takes many lanes to get to the goal that you all are most likely trying to get to from what I'm hearing, okay? You need law enforcement to do their thing. You need prevention services to do their thing. You need the school board to do their thing. And Cure Balance Global, what we specialize in is getting into the nitty gritty of high risk interventions, right? We're the ones that say, when everybody else is saying, hey, it's a little too hot for me to deal with, and ain't got nothing to do with me, we're the ones saying, actually, that's the perfect situation for somebody like me, because I have the relationships, I have the training, I have the skills to hopefully get this person to, to remove some barriers in this person's life and help them make that change, okay? And while I'm on that topic, what we also aren't doing, we can't change people, right? We help people change themselves, right? So I want to put that out there too, because there's a lot of misconceptions about community violence intervention, okay? So we talk about the partnerships and buy-in again. You see some examples of some agencies that typically partner with the implementing agency or the steering committee that is looking to implement our model. You see government agencies, again, you're talking about the public health offices, you're talking about the school districts, the hospital system, social service providers. And what you're seeing everybody who usually has a hand on people who are high risk, right? The educators, law enforcement, the healthcare workers who are treating these individuals who may not have the services in-house to provide. But we want all of them at the table because this is a collective effort, okay? You talk about the adequate funding. We know, it takes money to get this stuff done, right? It takes training. It takes all these resources, and that does take funding, right? And then once we get that and we get everybody trained up, then we can start to detect and interrupt, right? So that's where you talk about preventing retaliations, mediating longstanding ongoing conflicts, and keeping the pulse of the community, right? Keeping conflicts cool, okay? You talk about identifying and changing behaviors. We talk about what's normal. We need to be working with the highest risk. This is not, we're not looking to work with at risk. I grew up at risk, right? But I was not the highest risk. Okay, there's a lot of people at risk. Okay, we don't want to be one of those communities or one of those agencies who's filling up at risk individuals on our caseload. We want the people that is driving, the ongoing conflicts that we're seeing in our communities. Okay. The goal is that it's because we're trying to change their behavior, trying to help them change their behaviors. Okay. And if we get those that's driving it, if we get them to get on the straight and narrow and start to change their behaviors, then it has that domino and trickle down effect. Okay. But it does take time. And that's why you see that last bullet point there, case management. Intervention does take time. Okay. We're not going to implement this model and see 100% reduction in 30 days, right? Where CBG would never promise that. You know, there's a lot of things we never promised, but I want to be transparent about what you can expect, okay? We're going to be working hand in hand with individuals who are high risk on an ongoing basis, weekly, bi-weekly, monthly basis, tracking their progress, right? Looking at their risk, their needs, and their resilience over a given time to be able to track where they were when they started and where they are currently, whenever that point is, okay? And the last and one of the most important about points is the reason it is so important for all of our community residents to be here is because we mobilize community, and that's how we change norms, right? When you have a whole community rally and respond to every shooting incident, every single shooting incident, right? And it doesn't mean, you know, and that all looks different, right? It's not always a cookout or a march or whatever the case may be, but we're responding to everyone to let people know this is not acceptable, right? This is not acceptable, okay? And we want to spread positive norms, okay? Thank you, brother. So before we implement, Cure Violence Global conducts a CBG, Cure Violence Global, we conduct a readiness assessment, okay? And now I'll read this very briefly for y'all, but Cure Violence Global conducts assessment for all interested communities which have demonstrated necessary buy-in from essential stakeholders and leadership, okay? In addition to a 2 to 4 day in-person visit, the readiness assessment includes one-on-one workshops with representation from key agencies, which we just covered. We'll talk about a data review meeting. We'll review the target areas that you're thinking about implementing, and we'll have meetings with potential workers or implementing agencies, okay? Once completed, we'll then provide partners with a detailed report summarizing our findings, as well as providing recommendations for implementation, okay? And this is a 20 to 25 page report that I get the privilege of writing up for you all once I get done collecting all the quantitative and qualitative information. Thanks, sir. All right, so kudos to you all's leadership. I gave them the option of including this exhibit, this timeline in this presentation because this is included in our agreement. So the fact that they urged me to include this, I think is a very good sign for your community. But and I was totally on board with it. I think it needs to be put out there. But this is our tentative timeline for the readiness assessment, right? So this does not include implementation, post-assessment, but this is our timeline for the assessment. And I will let you all know that as of today, we are right on schedule. We are right on time, okay? So if you look at what took place in the first month that we're closing out here, we're establishing regular TA calls with myself and with members of the mayor's office as we try to identify the steering committee. I've put in a request for the historical crime data, and I just want to say thank you all because I've already received it and our team is already working on the analysis. So kudos to you all for having it prepared, and shout out to Lieutenant Colonel Henderson for being my point of contact on that. Okay, we're also doing some CBG one-on-one workshops with some key stakeholders. So I've been in contact with Darius, who's been my main point of contact at this point, but I'm sure he'll be contacting some of you all as we go forward to be involved. And I'll just say this, if you're looking to be involved and if you're not on the steering committee, I'm going to be back in March for a 2 to 4 day in-person visit. We're going to have various meetings for different stakeholders for everybody to take part of if they so wish. So you will have a chance to participate. This is a all hands on deck strategy, and it needs to be represented through implementation. All right, and so again, we talked about some of our success rates. These are now CBG, we've written our own evaluations as well. These are independent evaluations. These are evaluations and numbers from researchers and evaluators who are not affiliated with Cure Violence Global, right? And so you get that third party look at some of our success. I told you that we're Cure Violence Global and we work all over. If you look at, we've had reductions in Puerto Rico, Honduras, Baltimore has seen some great numbers. This is from 2016, but even recently they've just released a report to highlight some of their success. And this is just a snippet, you all. We work with over 25 to 28 cities in the U.S. alone, and we have 30 sites in New York alone. So when I tell you that it works when implemented correctly, it really does work. All right. So that is going to conclude our very short presentation for you all. A lot more information for you all at our website at www.cbg.org. And if you want to contact us, the contact number is up there, but also you all can go through your proper channels and contact me directly as well. So at this point, I'll turn it back over to Darius, and I'm sure there may be some questions.
Thank you very much, Q. Certainly a lot of great information. Looking forward to the partnership. I'm going to turn it back over to the mayor and the commission, or anyone else that has questions.
Okay, thanks a lot, Q, and thank you, Darius, as well. We have a short time frame of 25 minutes before we have another hard stop. So I'm gonna let my commissioners ask a couple of questions. Let's sort of rotate, and maybe two questions, and then we move down to another commissioner to make sure that we have balance, if you will, in terms of the questions that we have. And the answers that we give. So we'll start with Commissioner Turner-Sloss. Thank you for being here.
My pleasure, Mayor. Thank you. Mr. Q?
Yes, ma'am.
Thank you. Thank you very much for being here. Hope you had a great drive up from Louisville.
Yes,
Safe travels back home. I'm very excited about this program. This is something that's well overdue. Actually, Commissioner Fairchild introduced this back in 21-20? And this was something that we've been, again, trying to press forward for quite some time. So I'm glad that we're here at this moment. With all that being said, could you just remind me again when the conversation, because to your point, right, this is, you're from the outside looking in, not necessarily knowing all of the players, not knowing the pulse of the community. When is the implementation of those, our members of the community, when would they be a part of the conversation to start moving things forward, to have those interruptions to move the program?
Yes, ma'am. That's a great question. So there. Thank you. So thank you. That was a great question. There will be two opportunities. One of our former recommendations throughout the assessment process is that there is a steering committee made up of various stakeholders, and the reason why is because, again, this is a community strategy, right? That is directly affecting the community, and so you want to make sure that steering committee has representation, right? But when you talk about steering committee, not everybody will have a chance to sit on that, but there may be opportunity for community members to sit on that in various roles. But the most likely opportunity to participate will come in when I or my colleagues return in March to do the 2 to 4 day in-person portion of the assessment. Over that time, over that 2 to 4 days, Darius and myself will coordinate a schedule of CBG one-on-one workshops with various community members, whether they be local business owners looking to be involved to see how they can partner, interested workers, whether they're interested in being a violence interrupter outreach worker, whether they may be interested in implementing, so maybe they're interested in applying for the RFP or the RFQ to apply to implement the strategy. So it is most likely that during a 2 to 4 day visit, again, according to our timeline, in early to mid-March.
Okay, thank you. I know we're pressed for time.
Yes,
I can talk because I do have a couple questions
Yes, ma'am.
offline. So where does the Omen Group and the Cure Violence program come into play in working together for the campaign itself?
Yeah, and I'll probably defer to Darius a little bit, but I will say that we are building that relationship. We've already been on calls together, and I look forward to it. But I'll let them answer that.
Yeah, sure. Great question. I think you arrived after my part of it, but I'll go back and talk a little bit about that. So one of the things we did is coming out of those community engagement sessions, right? So there were, and you were able to participate in that, Commissioner Sloss, where we had 56 ideas that we mapped out: high priority, easy to implement, low priority, those sorts of things. Those ideas then become part of these subcommittees that have been formed. We've made a recommendation to the office. Those become a basis for the people that Q is recruiting in that March timeframe, because those are people who are already engaged in this conversation around peace in our community and what that looks like. We've already done some of that visioning with them. All that work also gets turned over to Q. We had that initial conversation where we talked about, here's some of the things that we picked up from those sessions. Here's what we heard the community say. Let us hand those over. So it was really meant to kind of give them a fast start on that. In terms of the campaign, to answer that part of the question, we rolled out that icon, the real kickoff, while everybody here tonight is sort of getting a preview for that. But in the State of the City is really the official launch, right? So that hits on February 12th. Right in this midpoint as we start to begin this conversation around cure violence, as we talk about peace in Dayton. Does that answer your question?
Yes, thank you. And so after the assessment is completed, then the RFP will be released. Is that correct? Or when does the RFP come into play?
Darius
The
has it.
release of the RFP, excuse me.
Yeah, so the goal, Commissioner, is going to be, once that assessment is completed and we begin drafting that RFP, the goal will be to obviously identify a CBO, community-based organization, that will function as the host of CBG. So I don't have a hard timeline right now for you, but I think everyone in this room can attest that we need to be urgent, right? And we need to keep the ball rolling.
Before the
So
summer months.
yes, I mean, ideally, of course, right? So the goal will be shortly after the assessment is done to begin drafting an RFP. And then, of course, establish a proper timeline to identify the right CBO so that we can, really get this thing on the ground and have staff and really bring it to life here in Dayton.
Okay. And last question, we'll have technical assistance for the various community partners to set up the proper establishment for CBOs.
Yes.
And so who is hitting that piece? Is that community engagement, or have we gone that far? Have we?
When you say technical assistance, you're referring to is how the program will be built out?
Yes, how the program will be built out, and again, having the necessary documentation to be designated as a CBO.
Yes, so we're going to be working very closely, hand in hand with CBGQ and all their staff to make sure that we're doing this correctly. You probably heard him say, for this to be effective, it has to be done right.
Right.
So obviously, we want to make sure that we're following their advice. So they will be providing a lot of that technical assistance. And obviously, whatever CBO is identified, the mayor's office, city staff will, of course, be a convener between that CBO and CBG as we try to make sure that we're following all the best practices.
Okay, thank you. I would like to be intimately involved, so I would like to have periodically.
Commissioner, we have you on the committee.
So thank you. Thank you, Mayor. Thank you.
It's at the, 2 months ago or a month ago? So,
Yes,
thank you.
thank you, Mayor. All right.
For being there.
Thank you.
Commissioner Fairchild, questions?
Yeah, that last conversation answered primarily my first one, which was around the timeline of getting the CBO that's gonna do the work. Can you tell me the relationship between what in your timeline for the first 3 months is the oversight agency and the CBO? Are those one and the same things, or is the oversight agency something separate?
That's a great question, sir. Thank you for that. Typically, when we refer to the oversight agency, we're referring to the funding agency. So typically, in this case, correct me if I'm wrong, Swami, my language is correct, the mayor's office or wherever the funding is coming from, who's ever going to oversee that. Okay, so it would be the city. The city would be the oversight agency, and then the CBO would be the implementing agency.
And where do we start kind of bringing in credible messengers? Because when I've looked at the pictures of the groups, what I haven't seen are people who I think the community, depending on what segment of the community, but the community of people who are engaged in violent activity would see as credible messengers.
Yeah, it's a great question. In terms of the assessment, we include in the number of meetings that we have, we include a meeting just for interested individuals that are looking to either be violence interrupters, or the other position is outreach worker, right? And so the outreach worker are your case managers, and the violence interrupters, they're violence interrupters, right? And so they're similar, but two different roles. But anyway, to your question, that would be the best time to engage them during the assessment period. But I would say it doesn't have to start then, right? It's always, if we're working in-house while we're going through this assessment period, if we're on you all side starting to identify who those individuals may be, it's going to be a much smoother ride once we get to that point. Thank you.
Commissioner Shaw.
Thank you, and thank you all for being here today. I just think back, we've had many different attempts at addressing violence in our community. This feels a lot different. Feels like a more intentional way that we're doing it, and I think that we are bringing the appropriate folks to the table. And I'm glad to hear from you, Q, that as time goes on and we kind of build this out, that there will be more opportunities for folks to come on board that are appropriate, that can do the outreach that you're talking about and the violence interruption that we all view as being very, very important. So I want to congratulate you for that. I don't have a lot of questions. I just want to say thank you for this work, and thank you to the community that is here tonight that expresses the interest in doing so. We have had contact with a variety of folks. I kind of had the same question when I saw the picture. Where's the Monty Bushes of the world and other folks like that we know, Tony Ruby and folks that we know that are in the community and working with the folks that are most at risk and the very high risk individuals. So I just know that this is the beginning stages of this, and that it will evolve and grow into what we want it to be. But I just feel like this is a lot different than the attempts that we've had in the future. And if we build that out right in the past, thank you. And I know that it will be successful because we've already said this is going to be something that's generational, that it's going to be ongoing. And we know that that's the most appropriate way to address violence in our community. So thank you for the work.
Thank you, sir.
Thank you, Mayor. My fellow commissioners have made excellent comments. I'd just like to make two points. First, I really appreciate that this is a data-driven approach. Like Commissioner Shaw said, it feels different from some of the approaches that we've tried, although I will say that it feels like we've been working up to this in some ways. A lot of these elements we've incorporated the data here and there. We've incorporated community leadership. We've incorporated taking action locations, but we haven't ever really brought it together, and not in a framework like this. It makes so much sense. So I think I really appreciate that, and I think we have a high chance of success here. The second is that it seems to me that a really key piece, and you said this already once, I just wanted to bring it out, that it's really important that we have the right people at the table and that they're trained well. I think that's maybe the hardest thing to do, and if we get it right, it gives us the best chance of success. But thank you. Just like Commissioner said, we really appreciate you being here. This is awesome.
Thank you, sir.
I really want to thank all those individuals who've been involved thus far, and certainly you who are in the room right now. We had a situation a couple of years ago where we had one shot fired, if you will, at the Children's Parade. And there was a tremendous amount of alarm because something like that had never happened before. It caused a lot of outrage, caused a lot of concern as far as the community was concerned, because it interrupted something that had somewhat been sacred, if you will, before, in terms of not having individuals interrupt something like that. It was a side argument, had nothing to do with the parade itself, but a side argument. And there was no one that lost their life or was injured or nothing of that nature. After that, the event came together with the police and members of the community who had a close frame of reference, if you will, with some of the young people who have been involved in those type of activities. And we talked several different meetings about how we can find a way to improve the quality of life in the city of Dayton by virtue of peace and gun violence. We've had a rash of those things this past year. It's caused more and more of us to be concerned. And that's why we have moved, I guess, so quickly in this space here right now. But additionally, what we have been able to engage is more work with the schools. We see they're represented here as well. We have more representation, again, from other members of the community who are involved and concerned, who see some of the progress that we've made and want to see that continue. We don't want to have, again, members of our citizens, young or old, we're here like myself as well, especially with our young people, trying to make sure they understand that they have value, and we want them to stay alive long enough to experience the high quality of life that we're trying to create here as far as the city is concerned. Your work is very important to us, and you talked about a lot of things that have happened with some of the research that you have. I am concerned clearly about how we validate and move at a pace that everyone is happy with. Because I can tell you right now, we want this tomorrow. And we know it's not going to happen tomorrow, it's not going to happen tomorrow. But talk about some timelines, if you will, once you start getting some of this in place.
Yes, sir. Thank you, Mayor, for that question. In reference to the timeline, there's a reason why our assessment, draws out. I tell people usually 8 to 12 weeks, right? And that comes and goes depending on, there's a lot of coordination that takes place. And so we have to build that in. Cure Violence Global, we work globally, but, we work remotely, so we're not able to be in our office every day. So there's a lot of coordinations and meetings and actionable items that we're, constantly checking up on, checking in and almost a lot of our partners every week, depending on where we are in implementation. Now, once we get through the assessment and implementation is off good, then we'll dial that down a little bit. But I think I even told Darius, like, I want to meet as frequent as possible in these early stages, because these are the most important stages. It's important not to rush through because there's a lot of things that CBG has to come through before giving any recommendations, right? We would never give you all a report or recommendations without putting boots on the ground in your community first. That's just not what we do. We're going to come here for 2 to 4 days and make the most of that time. And even though I personally at CBG, Cure Violence Global, I manage probably 10 to 12 different other jurisdictions around the country. But when I'm here, okay? And I either move those meetings to before or after the workday, or I'll move them around. But when I'm here, I'm engaged, we're engaged, and we want that schedule filled up to make it as useful as possible. Even coming here today, one of my selling points to be able to make this trip possible, because just to be transparent, this travel was not budgeted in our current agreement. But I did tell Ms. B and Darius that I thought it was super important with with it only being a couple hours away from my hometown, and I told my boss, like, hey, this makes sense. And he trusted my judgment, and he's happy that we're here. The whole team's happy we're here. We're looking forward to that partnership. But Mayor, it is super important that we stick to this, that we don't lag through it, but that we go through it with intention, because you want to do it right. And unfortunately, every time we implement it, it's not always a success story. Unfortunately, we have to, conduct this in a intentional manner. The worst thing that I want to see a year from now is, if we don't have the right CBO, or we're hitting a hard reset, or whatever the case may be. Obviously, whether they're local, state, or federal, a lot of times it's taxpayers' dollars. And that means something to me as a taxpayer in my community. And, we want to be good stewards to that to the best of our ability at CBG. And we understand that you could have chose anybody to go and partner with, but you chose us. And so we want to respect that.
One of the things that is always heavy on my heart, and also sometimes light, great joy as well, is the fact of having been a former teacher and a former coach, understanding and also by listening to a lot of the young people about some of the things that are in their mind. They talk about the aspect of needing and wanting some training to create safe conditions, and then also be able to learn how to handle conflict and before it turns into anger, rage, and violence. And we know that that's come across a lot as we go through this process and getting information from the adults as well as the young people. How does that help if we're doing those kinds of things throughout our community? How does that help and contribute to the long-term peace that we're looking for in Dayton?
Yes, sir. I appreciate that question. It goes back to my point of, Cure Violence Global, we stay in our lane of intervention, right? So that means that we still need our prevention resources. We still need those after-school programs. We still need those, community development, courses or activities within the communities to empower, our young people. We work with individuals between, we say 14 to 35, and give or take whatever the case may be, depending on numerous factors. But we can't catch all, right? That's not what our model is intended to do. So it's super important to still have those resources in prevention and rehabilitation areas, so that it supports the work that we're doing in intervention. In terms of the trainers, the violence interrupters, the outreach workers, we're going to give them a baseline level of skills to mediate conflicts, to deconflict, situational awareness. You talk about safety, how to move in the community. What's their role in terms of the community? How should they interact and respect other people doing the work in the field, such as law enforcement, such as other officials and things like that? So they're going to get, our violence interruption training is 40 hours, right? It's a full week of training for them. And then on top of that, there's another 40 hours of training just for the management and supervisors who are going to be overseeing those teams, right? And then they get training on the data entry, on the data input, so that we can track the progress, right? And so, so it is super important that we continue those efforts along with prevention and all the other areas.
So the community still has, they still have a responsibility of continuing to create jobs, continue to find individuals to take those jobs, continue to find ways of raising the median income, continue to find ways of improving the quality of life in the neighborhoods. None of those things go away. All those things help enhance what it is we're doing.
Yes, sir, that's exactly correct.
So, additional questions? You got it? Okay, Rich? Okay. Okay, thank you very much. We got a little bit of time, 5 minutes. Okay, we're meeting.
Thank you, Mayor.
Thank you.
Give yourselves a hand.
Thank you all.